Exercise is generally safe, but what happens if you put your body under too much pressure? Hello healthy people, I'm Richard and welcome back to Exercise for Health, and in today's video I'm going to offer you 8 tips on what exercise considerations you should take if you have high blood pressure or if you're taking medication for it. If you are new to this channel, we offer tips, advice and exercises each week to help you manage your health condition and fitness levels. So go ahead and tap the subscribe button below and the bell icon so you're notified of when we upload a new video. So the first thing we need to answer is, what is blood pressure? Well, the heart pumps your blood through your arteries to all your organs and tissues in the body, a bit like a tap attached to a hose pipe, where the tap is the heart, the hose is your artery, and the water passing through is the blood. If the pressure wasn't there, then the blood wouldn't flow, so it is crucial to our survival. If your blood pressure is low, which can happen under certain conditions like high heat and humidity, you can start to feel faint or lightheaded, and you've probably felt this at some point in your lifetime. However, if your blood pressure at rest is consistently high, then this can be a risk factor for other health conditions such as a stroke or a heart attack. Sometimes there are indications that can lead us to understand why our blood pressure is high, for example, caffeine, salt, high saturated fat diet, prevalence of mental or emotional stress, obesity, family history of high blood pressure, or even high cholesterol levels. However, in about 85% of cases, it's not actually known what causes it, and this is known as essential hypertension. Blood pressure is measured using a sphygmomanometer to determine 2 numbers, a high number called the systolic reading and a lower number called the diastolic reading. Essentially, the systolic number is the pressure on the artery wall as your heart beats and pushes the blood around the body, so that's like when you feel the pulse. The diastolic number is the pressure pushed on the artery wall in between the beats when the heart is actually refilling with blood. So what is a normal blood pressure reading? Well, blood pressure reading of up to 120 millimeters of mercury over 80 millimeters of mercury would be classed as normal. But you could be considered as being hypertensive if your blood pressure at rest exceeds either 140 for the systolic reading and or 90 for the diastolic reading. From an exercise point of view, it wouldn't be recommended to undertake physical activity if your blood pressure is exceeding that of the threshold of 160 over 100 on either reading, as the risk would outweigh the benefit. If your blood pressure is classified as severe, 180 over 120 or higher, then you'd be strongly recommended to seek medical advice, as you may have an underlying issue that's causing such extreme blood pressure. In addition, if you suffer from diabetes, the thresholds are set lower as the risk for other clinical conditions is much higher if your blood pressure is not controlled. So what can you do to manage it? Well, firstly, in most cases, it may be just a change of your lifestyle. So reviewing your diet to reduce certain fats and salt and increase vegetable intake, reducing alcohol consumption. Yeah, that doesn't go down very well when I mention it. Quitting smoking, losing weight if you need to do that, so put less of a strain on that's placed on the heart and on the body, and generally being more active and reducing your sedentary time during the day. If this doesn't work though, after a period of time, then your GP may decide to prescribe you medication to try and get your blood pressure to come back down. But there are many studies that are now showing that regular exercise can reduce the blood pressure between 5 and 10 millimeters of mercury, which is just as effective as some medications. So this can go a long way to managing it for life. So what recommendations do I have if you've been diagnosed with high blood pressure but have it under control? Well, let's go through each one in turn. Right, tip number 1 then is to try and make sure that you can exercise for about 3 times a week. So 3 exercise sessions a week, and each exercise session you should be looking to be able to do at least 15 minutes of aerobic based exercise or cardiovascular based exercise. So this could be whether you're doing it in the gym environment where you can do it in a sort of controlled manner. It could be whether you're doing an exercise class. It might be though you could be going outside for a walk, you could go for a cycle ride, or you can even go for a swim. Okay, tip number 2. Tip number 2 is to make sure that you prolong your warm-up and cool-down before you do the main part of the exercise session. So normally most people would end up spending 3 to 5 minutes doing a warm-up and a cool-down at the end of the session. You need to be doing double that really if you've got high blood pressure. So looking to do between 6 to 10 minutes for both the warm-up and the cool-down. And the reason for that is you just want to gradually allow the heart rate to build up slowly. So you start with a low intensity, build the heart rate up slowly as you gradually increase intensity. So then the change of the actual blood pressure is a gradual change and it's not sudden. So certainly just don't go in, if you, let's say you go into the gym and you go on an exercise bike and you whack the resistance right up and start pedaling really quickly, that's probably the worst thing you can do. So just start off very, very gently, build up slowly, but about 6 to 10 minutes for each warm up and cool down. Right, tip number 3 is no heavy lifting, so no heavy weights. To give an example, Eddie Hall, who's the former world's strongest man, he lifted 500 kilograms on the deadlift, which is over 1,100 pounds, and they estimated his blood pressure to be 300 over 180. So phenomenal blood pressure that his body was under. That caused him to bleed from his nose and from his ears. So really, really important that you don't lift heavy. You should be able to lift any weight that you're lifting comfortably between 10 and 15 repetitions without actually straining. So any weight training that you're doing as part of your exercise program, just make sure that it's of a moderate weight and you can manage at least 10 to 15 repetitions. Okay, tip number 4 is no isometrics or no static holds. And basically what that means is having your body or muscles in the body actually undergo a contraction where they're not actually either getting longer or shorter. So an example of this would be something like a wall sit or something like the plank where you're holding the position, the muscles are under contraction. What that does, that actually then starts to push the blood pressure up in the body. So I wouldn't advise doing any static or isometric holds. It's better to make sure that while you're actually exercising that the body's consistently moving all the time. So no isometrics. Right, tip number 5 is no actual lifting of weights above your head. So what we don't want to do, if you're in the gym environment or even if you're at home, we don't want to be pushing weights up above your head. And the reason for that is, as you're pushing the weight up above the head, then the heart's got to work harder to pump blood against gravity in all these smaller muscle groups, and it then puts more pressure back on the heart. So I wouldn't recommend doing anything like this. You just need to find an alternative. So if you're wanting to try and work your shoulders as an example for the shoulder press, you would then change it for something like a side raise, side lateral raise, or you could even do a front raise, or you could do something like an upright row. So you're always looking for an alternative so you're not actually pushing weights up above your head. Okay, tip number 6 really coincides with some of the previous tips that I've already said, and that's to make sure that when you're doing any type of lifting, so any type of resistance training or weight training, to ensure that you're breathing correctly. So what we don't want to do is use what's called the Valsalva maneuver, which is where you hold your breath, because that's going to actually increase the amount of pressure internally and push the blood pressure up. So as an example, if I was lifting a weight, as the weight's being lifted against gravity, so the hard part, you should be breathing out. And then as the weights then lower back down, that's when you should be then breathing back in again. Okay, so making sure that you're breathing with the movement is crucial to not allowing the blood pressure to go up. Okay, tip number 7 is looking at how you actually structure your exercises within your routine. So ideally, you should use what's called a peripheral heart action effect. And basically that means that you pick an exercise that works the muscles in the upper body first, and then you follow that with an exercise that then works the legs. And then the next one after that is back to the upper body and then back to the legs. And what that does is it allows the heart to pump the blood to different areas of the body. So it shunts the blood to the upper body, then has to shunt the blood to the lower body. So it keeps the heart rate up, but also because you're working big muscles within the body and allowing the blood to flow round, it just actually allows to reduce the amount of blood pressure from going up. So peripheral heart action effect is probably the best way to do any sort of routine. In addition to that, it's probably best if you can try and stick to compound exercises rather than isolated. So an isolated exercise, for example, would be where one joint moves, like a bicep curl action. If I was lifting a weight doing this, it just means then the heart's got to pump the blood just to this small muscle group, so then there's more resistance pushing back to the heart, which is then going to increase the pressure. If I change that to something like an upright row, where I still work the muscles in the biceps, but I also work the shoulders and the muscles on the top of the back, there's more muscles being worked, so therefore then the blood's got to pump the blood into more of a cellular structure, so there's less resistance in the muscles, so therefore then that reduces the pressure, so you're not putting the blood pressure up too high. So compound exercises where two joints work, and also then peripheral heart action where you start with an upper body, then lower body, upper body, lower body, so move the actual blood around the body while you're exercising. So the final tip, number 8, then, this is where you need to consider other health conditions that you might have alongside your high blood pressure. So even if your high blood pressure is controlled, whether it's through medication or not, sometimes other health conditions may take precedence over how you structure your exercise program. So just make sure that the program that you're doing is tailored to you. Right, I hope you found those 8 tips useful on how you can manage your blood pressure while you're exercising. If you've got any questions, then leave it in the comments below, but otherwise stay active and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.